Never ignore that itchy red rash, because what starts as a few harmless spots could turn into something far worse. Think chickenpox is just a kid's problem? Think again. In rare cases, it can lead to pneumonia, brain inflammation, or even death. So how do you protect yourself and your loved ones? Stick around because today we're breaking down everything you need to know about chickenpox, its causes, symptoms, treatments, and how to stop it before it starts. We all know someone who's had chickenpox. Maybe you had it as a kid, maybe your sibling did, or maybe you've never had it and you're wondering, should I be worried? Here's the thing. Chickenpox is highly contagious. One sneeze, one handshake, one shared toy, and boom, you could be infected. And while it's mostly mild in kids, for adults and people with weak immune systems, it can be serious. The real question is, how do you spot it early, treat it fast, and most importantly, prevent it from ever happening? Chickenpox is caused by the varicella-zoster virus, VZV, the same virus that later causes shingles in adults. It spreads through direct contact, airborne droplets from coughing or sneezing, or touching contaminated surfaces. If you've never had chickenpox or haven't been vaccinated, you're at risk. It usually starts with flu-like symptoms, fever, fatigue, loss of appetite, and headache. Then, the telltale itchy rash appears. First, red spots pop up on your face, chest, and back. Next, the spots turn into fluid-filled blisters. After a few days, the blisters burst and scab over. The whole cycle lasts about 5 to 7 days, but you're contagious from 2 days before the rash appears until all blisters are scabbed over. There's no cure for chickenpox, but you can manage symptoms. For itch relief, oatmeal baths, calamine lotion, and antihistamines can help reduce itching. To control fever, acetaminophen, better known as Tylenol, can lower it. But you should avoid aspirin since it's linked to a serious condition called Reyes syndrome in kids. Hydration and rest are also crucial. Drink plenty of fluids and make sure to get lots of rest. For severe cases, doctors may prescribe antiviral medication like acyclovir, especially for high-risk groups such as pregnant women, newborns, and people with weakened immune systems. Most cases are mild, but in rare cases, chickenpox can cause pneumonia, brain inflammation, encephalitis, and skin infections from excessive scratching. Pregnant women who get chickenpox can also pass the virus to their unborn baby, leading to congenital varicella syndrome, a condition that causes birth defects. The best way to prevent chickenpox? Get vaccinated. The chickenpox vaccine, varicella vaccine, is highly effective, preventing about 90% of cases. Even if you do get infected after vaccination, symptoms are usually much milder. Who should get vaccinated? Kids get 2 doses, one at 12 to 15 months, another at 4 to 6 years. Teens and adults who haven't had chickenpox should get 2 doses at least 4 weeks apart. Already had chickenpox? You're likely immune for life, but the virus stays in your body and can reactivate as shingles later in life. So, let's recap. Chickenpox is highly contagious and spreads through the air and direct contact. It starts with flu-like symptoms before turning into an itchy rash. Most cases are mild, but serious complications can occur, especially in adults, pregnant women, and people with weak immune systems. There's no cure, but you can manage symptoms with itch relief, fever reducers, and rest. The best way to prevent it? Vaccination. It's safe, effective, and prevents serious illness. The bottom line, chickenpox isn't just a harmless childhood illness. It can be dangerous, but the good news is, you can protect yourself and your family with the right steps. If you found this video helpful, hit that like button and subscribe for more health tips that could literally save lives. And if you have any questions about chickenpox, drop them in the comments. We'd love to help. Stay healthy, and we'll see you in the next one.